I've been diagnosed with sciatica and bulging disc with trapped nerves. I've also been referred for surgery. Do I start these exercises, please? Honey, it depends on when you have been recommended the surgery. If you haven't been recommended for emergency surgery and they've been saying, I will consider surgical opinion, because often it's considered a surgical opinion. But that sounds like a very run-of-the-mill diagnosis. We've got a bulging disc, an injury at the level of the lower lumbar spine that is irritating some of the roots of the sciatic nerve, giving us the pain down the leg. The nerves are not necessarily trapped, but irritated would be a better word. That is basically a lower back injury. That's what most people have. So something to think about there. Do the rehabilitation work. Have a look, can you do a squat? The question you need to ask, I'm saying it time and time again, when you go into the appointment, people will often speak to the surgeon and they'll say, hey, can I do squats? I've seen this guy online, he says about doing squats. Should I do them? And he goes, no, don't do squats. And then what you do is you sit in the room when he says we're finished, you sit in the room and you say, that's cool, are you gonna wheel me out? Because you said I can't do squats and getting up hurts. So you're gonna wheel me out? And then he'll say, of course not. I say, well, why did you tell me not to do squats then? It doesn't make sense. It's a lazy answer. It's a very lazy answer. Because you're gonna do squats and many more things without any guidance from that surgeon while you're waiting to have the surgery. So wouldn't it be sensible or reasonable to have some level of guidance? You know, discuss it with them. Discuss it at your appointment, you know? You've got that expert insight. Go and have a chat with them. See what they say. Something to think about.